Pap test is suggested for young women beginning at the age of 21 to check for precancerous and cancerous cells. Today, Dr. Robin Leight of the Rutland Women's Healthcare Center joins us to talk about the recommendations.
Females come to their gynecologist or whichever provider who will do that service for them to have screening for early cell changes that might be precancerous or cancerous. And we recommend that females start that testing now at age 21. And when they're in that, when they're in the age category of 21 to 30, our primary focus is the cell test called a Pap test, used to be called a Pap smear. I think the name has changed because it's no longer a smear on a slide. It's a cell collection in liquids, which means we can process it a whole lot better.
Dr. Leight says it doesn't matter if a woman is having her period or has had a bubble bath or intercourse before the Pap test appointment.
After they reach age 30, we can add a second test to the Pap test, and it's screening for a sexual virus called human papillomavirus, or HPV. And we actually can collect it right off of the same cell collection that we put into a liquid vial and send to our laboratory right here at Rutland Regional Medical Center. The presence of the virus is the more worrisome finding because it is a precursor to cancer of the cervix. Not all women who have the HPV virus will go on to get cancer of the cervix, but we now know that almost all, if not all, cervical cancer starts from the HPV virus.
Girls and boys are now encouraged to get the HPV vaccine to protect against 4 common strands of the virus, 6, 11, 16, and 18, before they're sexually active. Dr. Leight says women shouldn't be concerned about the procedure of the Pap test.
Your cervix is the bottom of your uterus, which is your womb, and that is located at the top of the female vagina. So we need to be able to gently push apart the walls of her vagina with an instrument called a speculum. It's often referred to as the duckbill instrument because it has parts to it that look much like a duckbill. And after that has been introduced into her vagina and is gently opened just to see down her vagina, the cervix will be found looking like a round circular structure. And once we're looking down there, we need to reach down and do a scraping or swiping of cells. This is one of the instruments. There are actually 3 different instruments that we might need to use. And then we would deposit that instrument and release the cells into the liquid Pap collection fluid. Then that specimen is closed up tightly, labeled appropriately, and sent across to our excellent laboratory at Rutland Regional Medical Center.
Women are encouraged to contact their local gynecologist or primary care physician to set up an appointment.